Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Endocrine medications. Somatropin, Humatrope, is being given to a female patient with Turner syndrome. Which of the following findings is associated with this medication? Option A. Decreased ALT and AST level. Option B. Mild hyperglycemia. Option C. Hypotension. Option D. Water intoxication. Right answer is Option B. Mild hyperglycemia. Somatropin, Humatrope, is a growth hormone. Excess growth hormone causes insulin resistance and hyperglycemia. Option A. Elevated AST and ALT is expected. Option C. Hypertension, not hypotension, is a side effect. Option D is not related symptom to this medication. A nurse provides instructions to a client regarding the administration of the prednisone and instructs the client that the best time to take the medication is during Option A. Any time of the day. Option B. Early morning. Option C. Lunch. Option D. Before bedtime. Right answer is Option B. Early morning. Prednisone is a corticosteroid. Glucocorticoids is administered early in the morning because it helps in reducing adrenal insufficiency and simulate the burst of glucocorticoids released naturally by the adrenal glands each morning. A client with diabetes insipidus is taking antidiuretic hormone. Which of the following symptoms would alert the need to decrease the dosage? Option A. Alopecia. Option B. Jaundice. Option C. Diarrhea. Option D. Drowsiness. Right answer is Option D. Drowsiness. One of the side effects of taking antidiuretic hormone is water intoxication, which is manifested by a headache, drowsiness, lightheadedness, and shortness of breath. This could indicate the need to reduce the dosage. Options A, B, and C are not related signs to this medication. Which of the following medications decreases their action while taking thyroid hormone? Option A. Metformin. Option B. Warfarin. Option C. Zoloft. Option D. Epinephrine. Right answer is Option A. Metformin. Metformin, an oral hypoglycemic drug when taken with the thyroid hormone, decreases their action. Options B. Anticoagulant. Option C. Antidepressant. And Option D. Sympathomimetic, increases their action when taken with the thyroid hormone. Prednisone is prescribed for a client with diabetes mellitus who is using Humulin 70/30 daily. Which of the following prescription changes does a nurse expect during the therapy with the prednisone? Option A. An addition of an oral hypoglycemic medication. Option B. Increased dosage of prednisone. Option C. Increased dosage of Humulin 70/30. Option D. Decreased dosage of Humulin 70/30. Right answer is Option C. Increased dosage of Humulin 70/30. Prednisone, a glucocorticoid, increases blood glucose level, hence people with diabetes needs to increase the dosage of their insulin. Options A, B, and D will not help the cause. A nurse is instructing a client regarding intranasal vasopressin, Pitressin. The nurse tells the client that which of the following is a side effect specific to the medication. Option A. Runny nose. Option B. Headache. Option C. Flushing. Option D. Nausea. Right answer is Option A. Runny nose. Vasopressin administered via intranasal route causes nasal congestion/runny nose. Options B, C, and D are the side effects of the medication administered intravenously. A nurse is performing an assessment on a newly admitted patient who is taking propylthiouracil, PTU, daily. The nurse suspects that the client has a history of Option A. Addison's disease. Option B. Cushing's syndrome. Option C. Graves' disease. Option D. Myxedema. Right answer is option C. Graves' disease. Propylthiouracil inhibits the synthesis of thyroid hormone and is used to treat Graves' disease or hypothyroidism. Options A and B are disorders related to adrenal function. Option D indicates hypothyroidism. A nurse is giving discharge instructions to a patient who is taking levothyroxine, Synthroid. The nurse instructs the client to notify the physician if which of the following occurs. Option A. Cold intolerance. Option B. Tremors. Option C. Coarse, dry hair. Option D. Muscle cramps. Right answer is option B. Tremors. Excessive doses of levothyroxine can produce signs and symptoms of hypothyroidism, which includes heat tolerance, tremors, nervousness, tachycardia, chest pain, hypothermia, and insomnia. Options A, C, and D are signs of hypothyroidism. A nurse is giving instructions to a patient who is taking levothyroxine, Synthroid. The nurse tells the client that the best time to take this medication is option A. During bedtime. Option B. After lunch. Option C. Taken with food. Option D. Taken on an empty stomach. Right answer is option D. Taken on an empty stomach. Levothyroxine is taken on an empty stomach, usually before breakfast, to enhance the absorption. Desmopressin acetate, DDAVP, is given to a patient with diabetes insipidus. Which of the following therapeutic response should you expect? Option A. Decreased blood pressure. Option B. Decreased attention span. Option C. Decreased urinary output. Option D. Decreased blood sugar. Right answer is option C. Decreased urinary output. The therapeutic response of this medication is decreased urine output because it promotes renal conservation of water. Options A, B, and D are unrelated effect to this medication. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.